Good morning, everyone, and welcome to the Disability and Aging Community Living Advisory Committee. We'll just move on to a couple of housekeeping items so everyone knows how to participate with the next slide. So if you're joining us today, you can join by phone, tablet, or computer, and joining by audio by telephone, you can enter the meeting ID. We've got live captioning. We're here with Lucia right now, and this is accessible. This is to provide accessibility through the webinar here on Zoom. So we've got American Sign Language interpretation and live captioning. So to access the live captioning, just click to the bottom of your screen. And you can click the More tab to enable the captioning to show up on your screen. The recording today, this meeting is being recorded, so all of the slides, the transcripts and information will be posted to the California Health and Human Services DACLAC, as we affectionately acronym call this meeting, webpage. Time is being reserved for public comment today. So 2 minutes is allocated for each public comment. And so if you're joining by webinar on Zoom, you can just use the Q&A function, which is also located at the bottom of your screen, to ask your question or select the raise hand icon. And we'll announce your name or the last 4 digits of your phone number if you're calling in. So if you're joining by phone, you just need to press *9 on your dial pad to raise your hand. And then we'll call on you to make your 2-minute public comment. If you have additional public comments that we're not able to get to today, please email engage@aging.ca.gov. And now I'd love to turn it over to Susan DeMorris, the Director of the California Department of Aging and the DACLAC State Chair.
Thank you so much, Megan, and welcome everybody. Welcome to our DACLAC committee members and panelists, our partners across state government and state departments and agencies who are joining us today, and to members of the public who are listening in. Thank you for being here. This is our first meeting of 2023. As Patty, our co-chair, reminded me, this group has not formally met as a committee since last August. We were all together in September for the 2022 Day of Action in Sacramento, where the DACLAC committee was out in full force. And thank you for your participation and attendance there, and especially for your recommendations that carried forward from our time together. I want to especially thank Patty and Eric for leading this effort and for stepping up to co-chair this group. I also want to thank Debbie and Marty, our 2 work group co-chairs, or not co-chairs, chairs, respectively, of in their own right, of housing and transportation. So while we haven't met since August, work has continued, and I want to thank, this is a very hardworking group, whether it's formal meetings, informal meetings, or suggestions that you share individually and collectively with us to keep the work moving forward. We heard on September 20th, when we were together for the Day of Action, the priorities of this committee: improving accessible transportation systems to allow people throughout the lifespan to get where they need to go when they need to get there, and a strong interest in implementation and rollout of CalAIM. In addition to continued investments and prioritization of housing dollars. So in a moment, I'm going to share with you on the next slide, just a few of, sort of the honor roll of Master Plan for Aging initiatives as we embark on our new 2-year round of 95 initiatives. I wanted to highlight just a few that center really in the work of this committee. And before I do that, I wanted to make note, I hope you have all heard about the tremendous investments over the past year in the in-home supportive services workforce, training and stipends that have been led by the Department of Social Services, And just last week, the announcement of $89 million in new funding to 78 community organizations to support the direct care workforce led by the Department of Aging and the CalGROWS initiative. So while we're not talking about workforce per se, our workforce underpins all of these initiatives. So quickly, we'll move through on your screen. You'll see just a few that we want to highlight, but I hope if you haven't yet looked at all 95, that you'll take the time to do that, and we'll share in the chat the list of the updated initiatives so that everyone has access to that information. All of these intersect, very few of these stand alone, and this committee is where it all really comes together. This is the heartbeat of our state's long-term services and supports and home and community-based services. So the first, Initiative 2, is focused on housing. We recommend exploring emerging local government models, similar to what we've seen in Santa Monica and San Diego, to inform consideration of rental subsidy programs. Initiative number 9, transportation. I hope members of the transportation work group led by Debbie Toth recognize the exact words that were shared at the Day of Action, carried forward into the new round of initiatives here with consolidated transportation service agencies. Initiative number 18, this group has been following closely the potential and hope for a universal long-term services and supports benefit in California. That work had been led by a stakeholder group, CADA, the California Aging and Disability Alliance, and there have been many, there's been legislation and budget investments over the past 3 or 4 years, and again this year with a $5 million investment that the Department of Aging is overseeing to continue this work. The next 2 initiatives are a set. Initiatives 18 and 19 go hand in hand. Some of you I recognize some of you from the kickoff of the of our work for the roadmap. So this would be the multi-year, the collaborative effort. We're extremely proud of the work being done jointly with Department of Healthcare Services and the Department of Aging to do a gap analysis and an home and community-based services roadmap for our state to really examine what exists that is supported by Medi-Cal and what exists that is supported by other revenue sources, such as the Older Americans Act, independent living centers, and other resources, how they come together and where the gaps exist in our state. Initiative 21 is one of several that focus on CalAIM, and this is looking now as enhanced care management and community supports are up and running and fully implemented to begin collecting data on usage and utilization by older adults and people with disabilities. And then the last are 2 more. These link together as they all do. Initiative number 70, further exploration and investment in a statewide California's first aging, disability, and caregiving contact center and a consumer-facing web portal to really help with navigation and connection to resources and referrals. And then last, Initiative 71, the furthering our work on the No Wrong Door initiative. This ties directly to the Aging and Disability Resource Connections, but brings in so many other partners up and down the state and across government. So those are the highlights. You'll hear more about the master plan shortly from Amanda. We look forward to working with this committee in the coming year. Over the next several meetings, as we move into the spring, we'll be asking for those who serve to recommit if they'd like to for 2 additional years. Perhaps your time has come to a close and you're not able to serve any longer, or you don't wish to, and we'll be asking for members to reapply. And then we'll also be asking for recommendations to deepen our connections into the community and to enhance representation and equity on this committee. So we'll be coming back to you this spring to refresh the committee, as you've all been serving, all but I think Debbie have been serving 2-year terms. So now it's my pleasure to turn the agenda over to Amanda Lawrence, who will walk us through the Master Plan for Aging updates.
Good morning, everyone. It's so nice to be able to connect with you all again. We haven't seen you since September 20th. I hope you've been well. I'm going to go over a few milestones that we reached with the Master Plan for Aging. On the next slide, you'll see that, and I'm sure you all know that we released our Master Plan for Aging Progress Report last month. And this report highlights accomplishments of the Master Plan, as well as many of our local partners in aging and disability across all 5 bold goal areas. And this report can be found on the Master Plan for Aging's webpage. To continue building on the work of the past 2 years, we've released the Master Plan for Aging's 2023-2024 initiatives. Susan just highlighted just a few of those 95 initiatives for you, but these represent commitments from across the governor's cabinet for implementation over the next 2 years. And your voices were integral to the development of these initiatives. I hope that you see many of the recommendations that this committee and the other committees shared in September at the California for All Ages and Abilities Day of Action reflected in these 95 initiatives. And these are also available on the MPA's website for you to review. I really want to recognize all the work that has been accomplished across the entire cabinet. And in particular, we've had so much support from California Health and Human Services, sister departments, and Secretary Galley, who has been just such a phenomenal leader in advancing the Master Plan for Aging and helping us to execute these 95 initiatives and be able to provide this report for everyone today. On the next slide, you'll see the third milestone. Oh, next slide, please. Then our third milestone is providing this implementation tracker. So since we launched the MPA, we refer to it as a blueprint for action. It's flexible, it's adaptable, it's not a report that sits on a shelf. And we want to create several layers of accountability to hold ourselves true to that commitment. And the first of those 2 realms of accountability are the Impact Stakeholder Advisory Committee, who have provided oversight and recommendations and very much welcomed constructive critiques to the Master Plan for Aging over the last 2 years. And we also have developed the data dashboard for aging, and we've continued to improve upon and expand the data that's available on that data dashboard. But as our third layer of accountability, we released our publicly available implementation tracker. This is a public-facing database, essentially, that allows users to search for progress updates of the over now 200 Master Plan for Aging initiatives. So you don't need to wait for the annual report. Our annual reports will no longer be 50 pages. They'll be much more concise, and you will have the ability to search for the updates that you're interested in on our database. You can search by agency, department, topic area, goal area, several search mechanisms in here. If you haven't had a chance to check it out, please do. Feel free, if you have any comments, recommendations for how we can make it more user-friendly, you can always email the Master Plan for Aging team at engage@aging.ca.gov. And we really hope that you find this to be a valuable tool. You can also just search the initiatives in there. Of course, the 23-24 initiatives don't have updates yet, but we have a pretty comprehensive list of updates from across the first 132 initiatives for the first 2 years of the plan. And I'm going to go ahead and pass it back over to Susan for the next agenda item.
Thank you, Amanda. Is it my honor to describe the local aging grants, or is that something that you were going to do?
Well, apologies. I can do that. I
Think because you're working so hard on this, you should share this item.
will do that. Yes, so exciting. So later this month, California Department of Aging will be releasing a request for applications for the $4.5 million Local Aging and Disability Action Planning Grant Program. We are so pleased to be able to offer this opportunity to assist local communities in developing their own aging and disability action plans, similar to the master plan for aging, but on a local level. Our priorities in this grant program are really to advance equity, to ensure cultural competency and community engagement principles and practices. Again, we'll release the RFA in just 2 to 3 weeks now, so please keep your eye out for that. Of course, we'll email all of the committee members about this opportunity. The grant awards will be between $75,000 and $200,000, and it's approximately an 18-month project period for the development of a local action plan addressing aging and disability. You can check out the website that we'll put in the chat box that has a little bit more information, but we'll continue to post updates and the RFA on that website in the next 2 to 3 weeks. Now I hand it back to Susan.
Thank you. We're so excited about that. And the next portion of our agenda, we're going to now move to our chairs. So all the lead up to Patty Prunehuber and Eric Harris, who will lead us through the next sections on the agenda. Welcome back, Patty and Eric.
Thank you so much. And I'm going to let Eric start, and then I will follow, because I always follow Eric's lead.
Well, it's wonderful to be here, everyone. This is Eric Harris, one of the DACLAC co-chairs. And first of all, I just want to reiterate what was stated earlier, that we're really thrilled to be back in the meeting space with you all, even if it's virtually for now. It's really great to be back on here and leading, hopefully leading a good meeting today. I think we have a lot going on, a lot that we want to discuss, several really important topics that were that we've talked about over the years, but especially recently, kind of really nailing down and getting some perspective on the HCBS settings rule, talking through other subcommittees that we have with transportation and housing that we're going to discuss with our subcommittee chairs, Debbie Toth and Marty Emoto. And then we get into the California Aging Disability Research Partnership, and then some public comment. So we're really looking forward to this meeting and glad to be a part of it and with you all today. So I'll go ahead and pass it to you, Patty.
Thank you, Eric, and thank you to Susan Demores, Director Demores, and the entire CDA team for helping the DACLAC committee do its work and be engaged in this process of advancing community living. It has been a little while since we've met, and I just thought a little bit of a reset on reminding us, as if you don't know in the work you do every day, that DACLAC is here to lift up and build on the values and principles of community living that's embodied in the Olmsted decision. And in our work, we try to be person-centered and equity-focused and advocate for systems change to advance community integrated living and choices. In keeping with that purpose, today we'll take a deep dive into California's progress toward achieving the goals and the goals of the home and community-based settings rule, which I will call HCBS. This process began in 2014. We're in the very final stages before the compliance deadline of March 17, 2023. Although California has asked for additional time, we will hear about California's progress to date and the important work we have ahead. And I say we because it is really a collaborative process that requires stakeholder engagement around how to advance truly integrated settings and homes for people living with disabilities. And in the flurry of paperwork, data, and reports, we want to keep in mind that that is the goal, not just compliance, but systems transformation. Realizing a vision where people with and without disabilities are living in a connected community with equitable access to expanded housing options in the most integrated setting possible, in a way that enriches all of our lives and our communities. And this approach models the California HHS principles that Secretary Galley has led and articulated by being person-centered, data-driven, and using an equity lens approach. This takes active and ongoing stakeholder engagement, support, and technical assistance for less resource sites, data transparency, and attention to resident rights. So we're going to begin with a short presentation from the two agencies that are charged with implementing the settings rule. And I want to thank Joseph Billingsley, Assistant Deputy Director of Integrated Systems at the California Department of Healthcare Services, and Jim Knight, Deputy Director in the Administration Division of the California Department of Developmental Services, or DDS, for joining us. And then they will be followed by Hagar Dickman, Senior Health Attorney at Justice and Aging, to offer some comments on the plan and our progress and the work to be done. And Allie Kennington, who is Senior Project Manager of Organizing and Advocacy at the Kelsey Project, which advances disability inclusive housing. I want to make sure that there's plenty of opportunity for stakeholder comment and engagement, which is going to be followed by public comment. And with that, I'd like to turn it over to Joseph Billingsley. Thank you, Joseph.
Thanks, Patty. And can you all hear me?
Yes.
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 Okay, perfect. Just making sure. I thought so, but I want to make sure that I hit star 6 right. Thanks for that excellent introduction to the HCBS settings rule and this agenda topic. I really think that you did a great job teeing up this agenda item, and really happy to be here and getting the opportunity to meet with the DACLAC committee today and talk through the work, the process that it has been in terms of working towards implementation and coming into compliance with the HCBS settings final rule. As Patty mentioned, my name is Joseph Billingsley. I'm the Assistant Deputy Director for Integrated Systems within our Healthcare Delivery Systems area of Department of Healthcare Services. Healthcare Delivery Services is responsible for our managed care delivery system, as well as our integrated systems of care, which include a lot of the various programs that DHCS operates that really provide specialized services and benefits to different populations. And within that integrated systems of care area are the various HCBS, or home community-based services programs, that are impacted and accountable to the HCBS settings rule. So next slide, please. I just want to again step back and recognize the process that we've been going through in terms of really working towards implementation of the HCBS settings rule. As Patty mentioned, this was first put forward back in 2014. So this has been a long process in terms of the work that states have had to do to develop statewide transition plans, work with the Centers for Medicare and Medicaid Services, just in terms of continuing to define criteria around the final rule and how it's impacting individuals and how they access services in the community. And then, working with stakeholders, with providers, to ensure that we're then taking the necessary steps to assess compliance with the rule, to do that systemic assessment of our state and how we come into compliance with the rule, and then to do necessary provider education and technical assistance and remediation work with providers towards helping to bring them into compliance. Because again, the goal again with the rule is one, really ensuring that individuals that choose to access services in their homes and communities are able to do so in a manner that offers them dignity and respect, and how they're receiving those services, and really provides for a true home and community-based experience that's separate and apart from a more institutional-based service delivery system. So I think that to that point, that's just continuing to work towards embodying that concept, and as our North Star when we're working towards this implementation. So I want to stay high level as we go through this. I don't want to take too much time in going over, a lot of specifics around the background behind the rule, but also I'll walk quickly through these. But I want to talk around just providing a quick background on the settings final rule, speak to characteristics of the HCBS settings, talk about our settings assessment process, how we're working with the various impact or providers that the settings rule is applicable to remediate deficiencies and provide technical assistance. Talk about heightened scrutiny process, also about the corrective action plan that Patty mentioned that the state of California did submit to CMS in relation to our statewide transition plan for coming into compliance, and then just talk about where we are now and next steps. And so again, I think we've talked a bit about the background, but basically the HCBS rule was published back in 2014, and really it impacts and is applicable to HCBS services and authorities under that are made available through Medicaid. And so that includes our 1915C home and community-based services waivers, our 1915I HCBS state plan option. It covers any applicable 1915K programs, and also HCBS services made available under 1115 waiver demonstrations, like our community-based adult services program, or CBAS. Next slide. And again, I think we've talked about this a little bit already, but really just tying back to key points that it's goals and behind the HCBS rule are ensuring individuals that receive HCBS services have full access to the benefits of community living, that we're expanding opportunities for meaningful community integration in support of the goals of the ADA and the Supreme Court Olmstead decision, and also just working to enhance the quality of HCBS and provide protections to individuals receiving services. Next slide. And to that end, we've listed here things that the final rule is specifically addressing, including cultural considerations, visitors, access to food, landlord and tenant protections, freedom of movement, privacy, dignity and respect, and freedom from coercion. And next slide. And then also addressing the who is providing the services and supports wherever individuals live, who they live with. So again, this is just high level information around the HCBS settings rule. Let's go ahead and move to the next slide. And again, I think we can move on to the next slide in terms of time. I want to make sure we're getting for the meat of the pieces. The HCBS settings rule does basically establish characteristics of HCBS settings. So really working to define what are the characteristics of a home and community-based setting for individuals accessing HCBS services. And that includes that a setting provide for integration and access to the broader community. That setting is selected by the individual as a choice among options of how they're going to receive their services and through which settings those are available. So the individuals are having a choice in how and where they're receiving services. A setting must ensure individuals' rights of privacy, dignity, and respect, and also freedom from coercion and restraint. It's important that the setting optimize individuals' autonomy and their independence in making life decisions. And it's also important that the setting facilitate choice regarding services and who provides them. Additionally, in provider-owned or controlled residential settings, the rule further specifies that the unit or dwelling is a physical place that either an individual can own, that they can rent, or occupy under a legally enforceable agreement, so that they're actually being recognized as a tenant in that setting, or an owner in that setting. The rule also specifies that individuals have to have privacy in their sleeping or living units, including lockable doors, choice of roommate if sharing a unit, and the freedom to furnish and decorate their sleeping or living units within the lease or other agreement. They have to have the freedom to and support to control their own schedules and activities, and have access to food at any time. And they also have to be able to have visitors of their choosing at any time. And it's important that the setting is physically accessible to the individual. In terms of how, and sorry, if you can go back to the previous slide, the settings assessment slide. In terms of how states are required to assess settings, CMS did require, did and does require that states conduct validated site-specific assessments of provider-owned or controlled settings to ensure that they're meeting the final rule requirements. And the compliance date is March 17, 2023. And that as a part of that assessment process, when the state determines that providers are not meeting any aspects of the final required aspects of the final rule, that we're informing them where they're deficient, and working with them to identify necessary remediation to come into compliance. Next slide. So for remediation, and I want to specifically talk about work that DHCS has done, because we're going to make sure there's an opportunity to talk about what each department is doing. I think, again, just to take a step back, as part of this process, the state did, work to perform an assessment of, okay, what services do we have that are going to be, and specifically what settings in which services are provided, what waiver or HCBS authority settings do we have that are going to be subject to the final rule, and that we need to go through this assessment process. And so that was a joint process with DHCS and sister departments, and we did identify that we would need to assess the assisted living waiver settings under the assisted living waiver operated by Department of Healthcare Services, also the congregate living health facility setting that is available through the home and community-based alternatives waiver operated by Department of Healthcare Services. Additionally, it was identified that multiple settings operated under the development of disabled waivers, as well as the 1959 state plan option, HCBS state plan option for development of disabled would be need to be assessed for compliance with the HCBS settings rule, and then also looking at the community-based adult services center settings that's available under the 1115 waiver. So just talking a little bit about the process that DHCS has done in relation to the assisted living facility settings and the CLIF settings. Those settings, we did go through an extensive process of performing site reviews of all the settings, and then those sites did receive completed site assessment reports, and those identified any findings that were assessed as part of that assessment process. And then the sites had to respond back with remediation work plans, identifying to DHCS how they're going to address the findings identified and bring their setting into compliance with the rule. That was an iterative process with DHCS, and through that process, we worked to provide multiple opportunities for technical assistance, training, utilizing webinars just to continuously talk about what is the final rule, what are its requirements, how can, what are the activities providers can take to come into compliance. So that I just wanted to, that was an ongoing and iterative process just to develop those remediation work plans. And then following that, after development of the remediation work plans, the next step has then been for DHCS to be working with those provider settings to then assess, to basically provide evidence of validation. So to start the validation process of really working to validate that the remediation activities identified are being implemented or have been implemented, so that those settings are demonstrating compliance with the final rule, and that will continue to be monitored on an ongoing basis. Okay, yeah, next slide. Heightened scrutiny. This process allows California to demonstrate the settings can overcome the institutional presumption by submitting evidentiary packages for CMS review. Settings are determined to be heightened scrutiny as one of three prongs that basically would, initially give potentially identify a facility as being presumed institutional. And those prongs include being located in a building that is also a publicly or privately operated facility, which provides inpatient institutional treatment, located in a building adjacent to or immediately adjacent to a public institution, or a setting that has the effect of isolating individuals. And so that's been a process that California has been working through. We have completed, DHS has completed the heightened scrutiny process for facility or for the settings that identified to fall under one of those three prongs. And as part of the required process, did post that for public comment. And then those are being submitted for CMS review as a final step as part of our process for coming into compliance with the HCBS settings rule. Next slide, please. And then just to talk a little bit about the cap real quick. I think it's important to note that as we've gone through this process, obviously there's been delays in the HCBS settings rule and the statewide transition plan process that all states are required to go through. One of the major delays that impacted that was the COVID-19 public health emergency, which did result in the compliance date being pushed back and impacted activities that states were doing to come into compliance. In recognition of the fact that one, CMS has made clear that we need to, move forward with having that firm compliance date of March 17, 2023 to move forward with full implementation of the settings rule. But they've also recognized the impact of COVID-19 on basically the providers' abilities to fully demonstrate and come into compliance with some aspects and characteristics of the final rule. And I think we can all, understand and recognize that even preceding the public health emergency, states were dealing with, impacts of looking at how, strategies for addressing workforce shortages that were impacting, our provider communities, and those have been were exacerbated during the COVID-19 public health emergency. So I think that's where the corrective action plan recognizes that those issues resulting from the PHE and how it impacted provider workforces do impact a provider's ability to fully implement fully and successfully implement some of the requirements of the HCBS rule, but also recognizes that there are basic that there are requirements of the rule related to privacy, dignity, and respect that do need to be demonstrated. So CMS has allowed for states to submit corrective action plans to ensure that we have a runway for fully working with our providers to bring them into compliance, and that we don't have drop-offs, because the last thing what we're all working to ensure is we want to bring providers into compliance and so that they're offering these ensuring that the HCBS settings that our beneficiaries, our participants are receiving services through are meeting the intent of the HCBS rule, so we want to ensure that we're going through that process of bringing people into compliance, and so California has submitted a corrective action plan requesting an extension through June 30, 2024 to fully demonstrate compliance with the final rule. We think this is important because it recognizes initiatives that the state, our administration have already put in place in terms of current budget actions, home and community-based services spending plan initiatives that have been put into place and have a similar runway to the timeframe we're looking at to really work towards helping to address some of these the various workforce shortages that have been impacting California like other states, and so just want to flag that. That is the goal behind the corrective action plan. Next slide. Okay. So again, just real quick, because I want to make sure I'm transitioning over to DDS and ensuring time for everyone to speak. This is just speaking to department's roles. Again, DHCS is the single state Medicaid agency. So we have ultimate responsible from a Medicaid authority standpoint in terms of working to lead these processes and ensure that settings for which we're claiming Medicaid federal funding are compliant with Medicaid requirements, including the HCBS settings rule. Next slide. I think I've already spoken to some of this, so we can go ahead and move on to the next slide. And again, just speaking quickly, I know CDA is also on the phone, so they'll be able to answer, or also in the meeting, they'll be able to answer any specific questions. But we did reference that CBAS is one of the settings that were identified as being applicable to the HCBS settings rule. To date, no CBAS programs have been out of compliance with the federal requirements. The CBAS transition plan is included as attachment 1 to the statewide transition plan and describes the CBAS compliance determination process. And the Department of Aging works to continuously monitor to these requirements as CBAS centers are required to demonstrate compliance during their biennial certification renewal process. Next slide. And I think here I'll be passing over to Jim.
Yeah, thank you, Joseph. And I know we're running a bit behind, so we're doing a lot of similar things that Joseph mentioned as far as working through and finalizing our validation process, if you will. A couple things I want to point out here. The one there is the outreach and training. And first of all, while March 17th is a date that CMS sets as the date that we all need to meet these requirements, it's not a one-time event. And so that outreach and training will be ongoing, not just for providers, but more importantly, folks who receive services and their families. The rules really were about making sure that people have what their experiences are in the services that they receive, and the expectations for choices, having rights respected and the like. So we think it's very important that there is that ongoing conversation and information sharing with folks who receive services, as I said, to make sure that they're aware of what to expect in the services that they're receiving. And that also then ties along to the ongoing monitoring. So again, not a one-time event. It is that we're going to continuously review, work with not only providers, but also verify with people who receive services that those expectations and the rules are continuously being met. So thanks. And yep.
Much, and I appreciate that you were asked to cover a lot in a short period of time, but I think you've given us a very good framework to move to the next discussion. I'd like to turn it over to Hagar Dickman, who will talk a little bit about some comments that have been submitted on the plans thus far and how we can move forward. Hagar?
Good morning. Thank you. Thanks for having me. Yeah, this is a follow-up to our comments that we wrote together with Disability Rights California, which many advocates around the state have signed. We sent it out back in, I believe, November. And I just wanted to kind of have introduce a high-level discussion about why we advocate for the full implementation of the final setting rule. So if you don't mind going to the next slide. Because the setting rule is really there to benefit and protect actual HCBS users, I thought it would be good to just highlight what it is that the setting rule is really trying to accomplish, and what benefit would be for HCBS users to have a full implementation. So for HCBS users, implementation means that they would be entitled to a lease or other legally enforceable agreements. Right, they would have protected right to privacy, individual control over their own schedule, access to food at any time, and can have visitors at any time, and making sure that the setting that they're living in is physically accessible. If you can go to the next slide. The cost of inadequate implementation is also borne by HCBS users. If a setting is not fully compliant, there is a possibility of loss of funding provided by federal Medicaid matching. Consumers can lose their residence, have to relocate, or lose services without compliant alternatives. Or consumers can continue to receive services in non-integrated, inaccessible settings that don't live up to the spirit of HCBS setting rule or Olmstead. And so when we talk about full implementation of the HCBS setting rule, we are really walking a very thin line here between fully implementing in a way that puts people at risk of losing their housing if they don't live in a housing setting that is fully implemented, or letting settings kind of get under the radar and not be fully implemented, and then having individuals continue to receive services in non-integrated settings. If you can go to the next slide, please. We have this, DDS has been very helpful in providing compliance data on their website. So we think it's interesting to look at the numbers here. There's, if you can see on the top left, there's an indication of there are about 5,000 statewide residential settings. And this graph tells us how many of those settings have been assessed. As of the end of December, it's been 96%. And only 47% of those settings have been found to be meeting the setting rule. And we've got 53% of settings that are not compliant or are only partially meeting the requirements of the rule. And on the bottom here, I think it would be also interesting to look at why these settings are not meeting these rules. So these are the reasons that settings are not meeting federal requirements. And so if you look at the residential settings, and of course there's other settings as well, I'm just focused on, just because of lack of time, the residential settings themselves. So you can see that, for example, 1,106 settings are not meeting the privacy requirements of the setting rule. We have 834 settings that are not meeting the access to community settings. 866 settings are not meeting the right to be treated well. These are important aspects, important fundamental rights for all individuals, including individuals receiving services. And so you can kind of see why it's so important to advocates and to HCBS users that the setting rule be fully implemented in the state. Okay, you can move to the next slide. So for DACLAC, just to open the discussion, there is why we should think about why this is important to DACLAC and where is DACLAC fitting into the HCBS setting rule discussion. So first and foremost, the HCBS setting rule is really furthering the DACLAC mission. And the purpose of DACLAC, of course, is to advance community living, inclusion, and integration across the state. So this just HCBS implementation, setting rule implementation is really fundamental to that goal. HCBS settings are part of California's continuum of care and continuum of housing options. And so it's important to make sure that all through that continuum, those settings are fully integrated. And there is an opportunity here to guide the conversation on comprehensive integrated housing options. Okay, we can go to the next slide. So here are some engagement opportunities for DACLAC going forward. The goal of the setting rule and hopefully of DACLAC's work here should be to achieve truly community integrated settings with no loss of services or displacement of residents. And that can be accomplished through work in three areas: increasing resources, increasing transparency, and increasing setting availability. And these are really areas that DACLAC and other advocates can focus on around the state to ensure that all settings are adequately meeting the setting rule and that the rights and housing and services of HCBS users are protected. So for increased resources, we really want to encourage the state to dedicate more resources to support settings and becoming compliant, and more resources to transition HCBS users into community settings and away from nursing homes and institutional settings. We would like to encourage the state to increase its transparency through creating an ongoing stakeholder engagement committee in which DACLAC can participate with DHCS, DDS, as well as community participants, advocates, and HCBS recipients and their family members. And we hope that the state will consider providing a data dashboard where individuals and community members can look to see, to track what kind of settings are meeting the setting rule, which ones need assistance and support, which ones are going to be possibly not meeting the deadline in time, and also make sure that we have demographic data so that we could track whether there are any equity considerations or disparities in who is living in compliant settings versus non-compliant settings. And finally, DACLAC can work on increased setting availability, making sure that there are opportunities around providing services and publicly subsidized housing, leveraging community care expansion initiative, and supporting stabilized housing initiatives, and strategizing around bolstering housing options where people can receive their HCBS services in non-institutional settings. So I will turn it back over to you, Patty.
Thank you so much, Hagar. And I'm going to just, in the interest of time, move right into the next presenter, Allie Kennington from the Kelsey Project. Allie?
Good morning, everyone. Can you see me? It's wonderful to be here this morning. My name is Allie Cannington, and I am a disabled person myself, and am a part of an organization called the Kelsey. And I'm grateful to speak to all of you, DACLAC members and representatives of key state agencies, as well as the public, and speak alongside our colleagues at Justice and Aging. Today, I really want to speak to what so many of you all have been saying in the chat, as well as it's been noted by the speakers before me, but housing. What is the H in HCBS? The critical role that housing plays in achieving compliance with the HCBS regulations and advancing community integration. If you're unfamiliar with the Kelsey, briefly, the Kelsey advances what we call disability-forward housing solutions that open doors to more affordable homes and opportunities for everyone. We have over 240 homes in our pipeline and lead advocacy initiatives to support the market conditions to make inclusive housing the norm. Our mission builds on the legacy of the disability rights movement, transforming law and policy to create the infrastructure that affirms disabled people's rights to community living, as mandated under the Title II of the ADA and codified through what we're talking about today, the HCBS settings rule. But despite these policy mandates, California has yet to create separate but linked housing and in-home care infrastructures that enable and sustain people with disabilities and older adults' rights to live in housing of our choice with services and supports that are self-determined. And, you know, I think what's really evident today is that there's so much needed in the ensuring compliance, but my comments today invite a yes and. We need compliance, and we need to really envision what these infrastructures need to look like and on a daily basis across the state. So I invite DACLAC and all state agencies to see this transition plan as an opportunity to take a proactive, holistic approach to ensure the goals of community integration are fully reached. As it currently stands, you know, the final transition plan still is holding our state housing infrastructure not accountable enough for creating housing opportunities for people with disabilities who need supportive services. So a question we have is, what is the role of housing in our state's transition to full compliance with the HCBS settings rule? This rule, as we've already heard, seeks to eliminate housing development and operations that isolate people with disabilities, limit our access to community or integrated community involvement, or undermine people with disabilities' choice and self-determination. So therefore, we really need to think about not just the settings that isolate, but the settings that are going to be integrated, the settings that will support people with disabilities to live amongst people without disabilities. And so the concern that we have is, you know, if we're only thinking about compliance, we're just going to be focusing on housing that's specifically for people with disabilities. So therefore, I want to explicitly invite that we should be addressing how the state will create housing opportunities that proactively integrate and include people with disabilities, regardless of the level of support that that individual needs in their own homes. So for example, what about those, and Hagar mentioned this, but what about those whose housing will be threatened due to their current settings being incompliant? Those folks must have clear paths to housing that will be affordable, accessible, integrated, and inclusive to their needs. If the state housing infrastructure does not have an explicit role to play in these transitions, it will be more likely that thousands of individuals become homeless or institutionalized. In that case, the burdens of state costs are severe, and most importantly, there are serious threats to people's freedoms and lives at stake. Additionally, California's housing infrastructure must also have a role in ensuring people who would have otherwise previously been relegated to congregate and institutional settings, to ensure that they are explicitly included in the state's current and forthcoming housing investments. And such an investment cannot be distilled to just one program. For example, like the community care expansion, which is critically important, but we need all housing types that affirm people's right to housing and services in integrated settings. So lastly, I want to just share some broad-based recommendations that include funding integrated communities, that include housing for people with and without disabilities. Define the role of state and local housing agencies in delivering housing for people with disabilities in integrated and inclusive settings, and facilitate new and strengthen existing partnerships across state and local housing and services agencies. We need to increase funding and strengthen utilization of Medicaid housing-related services to ensure housing quality and retention for people with disabilities and, of course, older adults. And for housing-related services especially, what does this mean for property, resident services, and residents themselves in terms of how we fund and operate services in housing? And last but certainly not least, we need to educate the housing field on their role and duty in serving HCBS users. So that concludes my comments presentation, but I thank you again for the opportunity to speak today, and I invite DACLAC members and everyone on the call today to see the Kelsey as an ally and a partner in this work to move our state forward. And I invite you to reach out. We do convene a working group where we create greater policy alignment across disability rights and affordable housing. And so I look forward to further discussion and opportunities to work together. Thank you.
Thank you, Ali. And I just want to thank all of our presenters for, I think, setting the table for a really rich and robust conversation now. And we're going to open it up to our stakeholders for comments and questions. And I appreciate that there's been sort of a bold vision created here of what truly integrated disability forward housing could look like, and how we create the infrastructure for that, and how the settings rule is sort of one piece, but that we don't want to get overly focused on compliance as the end all and be all of this effort, but that we want to really advance a vision of community living. So with that, I'm going to open it to and lots of shout outs to the panelists who have presented and created sort of a great foundation for this conversation that we're going to get into now. So I see some comments about the data that DDS, that the DDS compliance data that's on their dashboard makes available. And I guess I want to just preface that by saying, thank you, DDS, for actually making that available. Sarah thinks that she's facilitating this, so I'm going to hand it over to her. Great. Thank you, Sarah.
Sure, absolutely. I'm happy to do so. And actually, we can take down this slide because we are not in public comment. I don't think we need a slide right now. Thank you. Perfect. I just wanted to, first off, as Patty said, thank you to all of our speakers, to Joseph, Jim, Hagar, and Ali. I think it was a really great overview of, the state's background and perspective on the work that they've done, as well as a perspective of older adults and people with disabilities. And at this time, we are really happy to welcome all of our DACLAC committee members to ask questions. We have about 20-25 minutes for questions and discussion. I mean, some of the key issues that have been raised, including housing issues, workforce issues, the importance of keeping our eye on the overall goal of ensuring that the HCBS settings are truly integrated community settings, and recognizing the tremendous amount of work that this takes to get there, and all the steps that are being taken at this point. So with that, I see that we have Marty Emoto with a question, and then Kim Mills. So if you have questions, comments on the committee, I encourage you to raise your hand.
Thank you. Marty Emoto, family member, parent actually, in CDCAN, California Disability Aging Community Action Network. And again, thank you for the presenters, everyone. It was very helpful. My question, and I put it in the chat as well, and it ties back to what Patty was saying and others regarding compliance, and really going back to what this all means to the individual, because the settings rule, the whole idea of HCBS compliance isn't just a rule on paper and that we check mark when we reach a goal or compliance of a certain setting. It actually, as we all know here, impacts individuals' lives. And as the previous presenter alluded to, someone could lose their home and everything they have and know, because we want to be compliant. And so my question is, the whole settings rule is also linked to the individual choices and to be guided by individual choices in a person-centered planning process. And I don't hear very much about that being discussed, but that is so fundamental. And my question then is to the state agencies, and Jim knew I was going to probably ask this question. Jim Knight, and for Joseph, thank you for your presentations. What is the state doing to ensure that people who receive services, are eligible for services, are getting the person-centered plan training, and that the choices they are making are put forward and incorporated in the person-centered planning process? And also, how are those choices guided and in terms of data, and also guided by the outcomes, so that we avoid people losing their homes and the state and the rest of us not knowing the consequences of their losing their home and services. And Michelle, you know this on, and you have told me over the years, and others, my own sister, if you lose your services, if you lose transportation, if you lose food security, you're going to be isolated in your home or lose your home. Because you have to go where those services are, or where the food is, or where the transportation is. And so let's get it back to the person that these are impacting. So Sarah, I'll turn it back over to you, because you can kind of thread.
Thank you, Marty. I appreciate that really important comment and question about what happens to the consumers, should a setting be not in compliance, and a number of other related issues. So I'll turn to Joseph and Jim to see if you have any responses to that.
Yeah, this is Jim. I'll jump in, and Marty, thanks for the comments. And I think you've heard us say a number of times that while these are referred to as rules, it gets back to, just as you said, it's about the individual, and that we need to do the quote, the person-centered part of this right, and everything else will really fall into place. So, a big piece of that, and I know I touched on it briefly when I spoke, was that, is that we need to continue the information sharing and training and outreach for folks who receive services in their families, so they know what to expect. So they know when people say person-centered or person-driven, what that means or what that looks like in implementation. And so that is going to be an ongoing process, because then that is going to inform, as you talked about, that person-centered planning process, so that we can get data on individual outcomes, which is where we are going towards, and what the legislature and the administration agreed to as part of the overall rate reform initiative that we were fortunate enough to get over the last few years. So there is still more work to do on that, and look forward to working with you and others on how to get there.
Great. Thank you so much, Jim. So just underscoring the importance of the technical assistance and the role that the state plays with that in helping those providers reach compliance. And I just want to make sure, Joseph, anything you wanted to add on to that?
Yes, can you hear me?
Yes.
Perfect. Yeah, definitely. I thought this was a great question, Marty, and I really wanted to to provide a specific example, because I think you're exactly right. Like, I mean, this does come back to a true, you know, in order to really ensure individuals are receiving services with dignity and respect in the settings that they choose, it comes back to a true person-centered process. I think that just to give a quick example, when we were going through the assessment and then remediation planning process, specifically with our assisted living waiver, one thing we identified that we were starting to see some systemic deficiencies across all of the different assisted living facility settings that we assessed, that were tying back to the person-centered care planning process. And we realized that these deficiencies were not tying to site-specific deficiencies, provider-specific deficiencies, but a deficiency in the care plan that DHCS had currently approved and was utilizing for the assisted living waiver. It just wasn't meeting person-centered care planning principles. And so as a result of that process, we put together a work group with providers and advocates to really look at that, the care plan that was currently being used, and to identify the gaps and what was missing, and to then work towards developing a new care plan to be utilized for that waiver to ensure that person-centered care planning process. So I just want to echo the comment that you were making, and recognize that, as part of this process of working towards ongoing compliance with the HCBS rule, that was an important outcome of helping us to recognize where there was a deficiency in our person-centered care planning process.
Great. Thank you so much for that. And now I'd like to turn to Kim Mills.
Thank you. Kim Mills, Better Life Together. I'm a provider of the San Diego Regional Center. We provide supported living, independent living services. Also advocate for inclusivity and equity across the state. I want to thank you, Allie, for really underscoring the importance for housing, because it's such a critical issue for all of us. And I think we're all passionate about it, but it just feels like a lot of the funding, whenever it is released, is for the larger developers, but for smaller developers who want to just get maybe some assistance for modification, I'm one of those. There's nothing out there. So we have to be creative in solving this issue. And so it may be other providers or companies or developers who are just getting started in the field who are just open to doing this. So just being open to that. I think, Susan, it was you who talked about housing, local government models, and one was in San Diego. And I was actually curious about that. What was that model? If you can elaborate on it under one of the initiatives, because it may be, I think we just have to be creative in solving this issue.
I believe, Kim, that you're referring to initiative number 2 in the MPA initiatives under goal 1, which is exploring the feasibility of a rental subsidy program by looking at what they're doing at the local levels, including counties like San Diego right now, who is launched.
It's a rental subsidy.
Mm-hmm.
Okay, got it.
For older adults, correct.
Are there
city of San Diego?
Sorry,
great. I'm here in San Diego, so I'm actually curious about that. And maybe I can follow up later.
I'll follow up. I'll send you information, Kim.
Thank you so much. But we have to look at other housing models. Maybe there's shared housing models. We have to set aside funds for smaller developers who are interested in providing housing as well as the larger ones. Because even if they get a lot of the funding, they only set aside a couple units for people who are disabled, and then you're on a waiting list forever. So I'm hoping that we'll be creative in solving this issue, because we all have to work together for this. Thank you.
Absolutely. This is big system change. That's a really important point of us all needing to work together on this. It's a kind of whole of system approach to the change. So I see we have Janie up next. Janie.
Hi, thanks. Yeah, Janie Whiteford with Seeker, California IHSS Consumer Alliance. And I can remember when the ADA first came out, and we were all talking about every new building that comes in that for apartment complexes, they must have a good quantity of ADA compliant apartment structures That's not happening now. And I see so many new apartment complexes going up here in Santa Clara County. And they're all high end, and there's no law that says these guys have to have some apartments that are accessible and are for low income. And I just think that we need to go back to that very basic ADA place and say, yes, we need to have some legislation that says this needs to be complied with from way back.
Thank you, Janie. I think that this is why this committee is so important, and why we have the housing subcommittee led by Marty Emoto to keep our focus on this issue, and Patty Prunuber as well. So look forward to hearing more and continuing our discussion on these issues also in our housing subcommittee discussion, but certainly important for this discussion as well. Peter Mendoza, welcome.
Thank you, sir. And I want to thank everyone for being here today. Before I state my question and comment, I do want to mention, for transparency, my day job, I work for the State Council on Development on Disabilities as a community program specialist. However, on this committee, I'm here as myself as a user of long-term service and support who is both a consumer, a family member role. I want to thank everyone for their presentations today. The question I wanted to ask is, looking for, physical accessibility is important, but are we making sure that program accessibility is a factor? For example, you want to make sure in whatever community-based setting, residential choice a person makes, they're able to access the services within the home, participate in activities. So I think there needs to be, and everything else that goes on in their lives needs to have a programmatic, accessible lens to make sure that information is presented and they can respond in an accessible format or have assistance. It brings, we haven't met since Lois Curtis passed away. And Lois Curtis, as you all might remember, is one of the plaintiffs in the Olmstead decision, which was a Supreme Court decision in 1999, which really was the impetus for many statewide Olmstead committees like this one. And I think in that spirit today, one of the other things that we need to look at is, how are people accessing services and supports? We hear from advocates or those representing advocates, people on various who receive direct care, whether it's, for example, in-home support services, about the difficulty in getting support. We hear stories both in email and periodically verbally about people being stuck in bed for an extended period of time, people going without food or water because they don't have assistance that they need. And so we need to revisit this issue and perhaps think about a work group, because these stories are heartbreaking. And this is really what Olmstead is about, making sure that everyone can live and thrive in their communities and be successful. Yeah. And I believe if Lois Curtis was here with us today, she'd want us to imagine not just what the law requires, but does it meet the true intent of the Americans with Disabilities Act, Section 504, or the Lanterman Act? Are people not only getting what's required, are they getting what they need to be able to thrive and enjoy life? And thank you.
Thank you, Peter, for those really important comments, thinking through not only about physical accessibility to programs and services, but also program accessibility. A lot of very important considerations. And I know we have a number of hands raised, so we're going to extend this conversation to 11:30. And I want to hear now from Aaron, but just also want to plug in terms of this housing issue, how important it is to think of the advancements in the CalAIM program. And, recently DHCS has leveraged some, a new rule with CMS about, providing some limited housing subsidies for people who are in CalAIM, who are at risk of institutionalization or need to transition to the community. So these types of things, as well as the other, community supports related to housing, are very critical. Of course, we still have a long ways to go, but I think it just shows the direction that we're trying to head in as a state. So Aaron, did you want to jump in now? Thank you for being here.
Thanks, Sarah, and thank you for extending the time so we can continue the conversation. I see Jessica and Michelle are after me. If I could be reordered to make sure that we have enough time to hear from the self-advocate members of DACLAC first.
Sure. I'm sorry. Yes, go ahead. Absolutely. Jessica Gould.
Hi, so I'm a legislative consultant and I work with the housing side of the disability world to help them implement some of these things on a legislative level. But what I noticed, you guys mentioned the term that in this space makes sense, which is person-centered housing and anything else. But is there a plan in place by this group to train potential developers, et cetera, who may not know what that actually means? Because it is a new concept in relative terms to this community as a whole. So is there a plan to get some knowledge and training into the system and into the individuals that will be responsible for carrying out the new developments that may not be as aware of the concept behind it?
Thank you, Jessica, for that important comment, highlighting the need for, training and technical assistance. Certainly that's something that's key to this. Joseph or Jim, do you want to add on to that?
Yeah, no, thank you definitely for that important input. And I think you're completely right there. And when we've been continuing, as we've looked at opportunities for really, addressing housing as a social determinant of health, a social driver of health, right? And also looking at how to, as part of treating the whole person and having that person-centered process of being able to connect an individual with housing and also necessary services within that housing. I think an important piece there is ensuring that, looking at where we can drive partnerships between service providers and developers, where you have the right community-based type, organizations as service providers that bring that person-centered knowledge and approach to that partnership with the developer in terms of how services are actually being co-located or provided within housing. So and I think that helps facilitate that knowledge and awareness on the housing side also with the developers. But definitely that's a very important point that, as we continue to look at opportunities for how we integrate services and housing, that there is that we're pushing and advancing that understanding of the person-centered process.
Great, thank you so much, Joseph. Michelle, and then Sylvia and Greg and Aaron. So Michelle.
Yeah, I think with any housing, we're as a state, we're not doing enough. I love that we have all these plans that we're supposed to be following and everything else, but I just don't see the implementation in a way that is no wrong door for the consumers to access these services and programs and be able to utilize them in a way that is productive long term. We get people out of nursing homes and we do these other services and follow them for a while, but what are their long-term outcomes and things like this that we should be actually helping consumers to maintain their housing, maintain their transportation and services if they need. Too much is put on the table that is supposed to be done and isn't implemented in a productive way. And I just think we can do better, and we should do better, and we should expect and want from our programs better. And until that happens and we push as a community for everybody to be able to live in a productive way, then we aren't doing our jobs. Thank you.
Thank you so much, Michelle, for that comment. And Sylvia, welcome.
To take on my mask very quickly. I just want to make comments for the implementation of SCBS. We all know how to implement that. It's the staffing. However, majority our providers are facing severe staffing shortage. And again, let me introduce myself, Sylvia Ye from Friends of Children with Special Needs, and we are serving the development disabled adults and children on that. So, you know, for the workforce shortage, you know, for In-N-Out Burger, they are paying $22.50 in the Bay Area. Their recruitment and Cadango, a daycare for assistant, is $26. So to compare with this just similar human service programs, we are just not able to recruit enough people on that. And even we are able to recruit people, we also need to provide very intensive training for our staff to really know what's HCBS and how to implement that on a daily operations on that. So I'm hoping that we can also find a way to help providers to recruit more people to serve our the disabled populations on that. That's my comments on it. Thank you.
Thank you, Sylvia. Just underscoring the tremendous importance of workforce. Without workforce, you know, none of this is successful. So we need to keep moving forward with these efforts. So Greg, then Aaron and Jeannie, and then we have to wrap up at that point because I want Patty to make the final comments before we move to our public comment. Greg.
Thank you, Sarah, and thanks to all the presenters. I just want to echo what some of the comments Janie and Peter made. Like them, I've been living and working with a disability for years, and it goes back pre-ADA and Olmstead. And we've seen tremendous gains, and we are continuing to make progress. But at the same time, as we are combining everything and looking at person-centered care, I definitely support that. But programs like IHSS, I don't feel like we're talking enough about it, and it's such a critical program. And so I just wanted to piggyback on Peter's comment. I would love to see us have some kind of a work group that looks specifically at IHSS. And we talk about enhancing the quality of the program, and it's a wonderful program, but there are so many people on the program that are just not getting their needs met. They're not able to handle the independent provider mode. And as far as housing, obviously, if you lose your IHSS, you're at risk for institutionalization. And, you know, I'm working on several committees for trying to house the homeless, and we're looking at IHSS in that arena, and that is just not going to work. However, maybe some kind of an agency or contract model of IHSS might fit into that area. And so I just want to thank everybody for all the work you're doing, and I would like to be more involved, specifically in the IHSS arena, as my full-time job is director of the Personal Assistance Services Council, which is the public authority in LA County. Thank you so much.
Thank you, Greg. Appreciate your input as well. Aaron.
Thanks for circling back, Sarah. It's a question to either agency or the departments if there are other efforts to create housing opportunities that we need that we haven't talked about yet today. Greg just did a good job in laying out some of the barriers, Michelle and Peter did too. The State Council on Developmental Disabilities created a strategic housing framework, really focusing on the over 60% of adults who are living with aging family members. And as this is a looming crisis for housing and homelessness. So I just want to see from agency or department's perspective if there are other efforts that they're working on to create housing opportunities that we need.
Well, that is a great question. I don't know that if Joseph or Jim wants to provide any comment, please feel free to do so. But of course,
Director Boss is joining us too, and she may have something to add.
Thank you. Yes, I would. Sarah mentioned with CalAIM, we are proposing the addition of rent and transitional housing for 6 months as a community support benefit. So that's a new kind of support in terms of the housing space that we are requesting from the federal government. And that would be through our managed care plans. And then in addition, our California Behavioral Health a community-based continuum waiver, which is a waiver that we will be submitting to the federal government in probably this summer sometime with regard to persons with SMI, SED, severe mental illness, and seriously emotionally disturbed. Also adding rent and transitional housing for 6 months as a benefit under the county behavioral health system, so especially mental health service. So really trying to provide those opportunities to provide a bridge for individuals as they transition from institutional care and opportunities for rent in the Medi-Cal program.
Thank you so much, Director Bass. We really appreciate your chiming in there. And I think that this also, goes to show how important it is for us to focus in on this issue as we have our housing subcommittee. And there's a whole host of data and work that can be led in that space. You'll hear from kind of our efforts as well to be looking at the data side and where the funding opportunities are for these populations. So with that, I want to turn over.
Sarah, if I could.
Oh, yes, absolutely. Director Bargman, thank you. Thank you. Please jump in.
Yes, really appreciate the discussion on all of the HCBS discussion, but lifting up the housing piece of it. Just taking a second to share that several years ago, we added additional service codes to be able to help support individuals in their independent living or supported living environments. And so we can always provide that information. But the other part is that we prioritized as one of the priorities for our community resource development plan development, where we have about $27 million every year. We prioritized housing as one of the elements as a goal to increase affordable housing across California for people who receive services from regional centers. Challenges, there's competing priorities, but I'm happy to say that each year we funded additional funds to be able to help match other efforts, and we've increased our affordable housing kind of unit count, if you will, significantly. This year, I believe there's 6 different projects that are going to be funded for a number of additional housing units. And then just here's a shameless plug. We have our work group under our Developmental Services Task Force scheduled on community resources, which is focused on housing, that's scheduled for February 21st at 2 o'clock. And we would certainly welcome anybody to attend. And I'll try to get that link in here. So if you're able to attend, I think it's going to be a really helpful and meaningful conversation focused on individuals receiving regional center services. Thank you.
Excellent. Thank you so much, Director Bargman, for that important update. We really appreciate it. And also just wanted to just shout out, it's wonderful to have Eric Harris, our co-chair, who's also serving on the California Interagency Council on Homelessness, and really can be a wonderful liaison for this committee to highlight some of these very same issues. So our final comment is from Jeannie Parker Martin, and then we'll turn it over to Patty to help us transition to the next segment. Jeannie.
Yeah, thank you, Sarah. And I just want to thank all the people who have already made comments because they're so important and so critical to our work going forward. I want to add a couple of comments related to some of the integrated care comments that were made earlier by a few others. There's been funding made available recently for a California Integrated Care at Home project that is working with Leading Age California as well as the city and county of Los Angeles. And this is a housing focused initiative that would also be targeting older adults and those with disabilities. So it's a really exciting opportunity to think through how additional improvements in housing care and services might expand in the future. This has already been tried in other states, and so we're excited that it might have an opportunity here in California. I also just want to comment earlier, there is a rent stabilization bill right now, SB 37, that Aaron mentioned earlier in the chat. And this is a really critical bridge as well to opportunities for affordable housing and keeping people in their homes at times when they may have challenges in meeting their rent. And then finally, I just want to make a comment about workforce because that's come up in a number of comments. There, as all of you may have seen earlier this week, there was an announcement of $400 million that has been distributed by the state related to various workforce initiatives. through CDA, HCI, and other departments. And I think this is really relevant to this discussion because it is training IHSS workers and other personal care assistants in a home or perhaps congregate setting. So I just wanted to give a few shout outs that way. So thank you, Sarah.
Thank you, Jeannie. I think all of this underscores that system change really relies on not just looking at health or human services, but it's housing, it's transportation, it's the whole, all of these components together that help advance the change. So I want to thank all of our speakers for really an informative discussion. I want to thank our committee members for being so engaged and for a really good, effective discussion. And I think this is a great space for this committee. And I want to turn to Patty to close it out and transition us to public comment.
Thank you, Sarah. And I want to echo that this has been such a rich discussion, and it brings me to my point, which was actually made earlier, that one of the things that we have in this room is such collective knowledge and experience, lived experience. And we want to make sure that there is a stakeholder committee on an ongoing basis that meets with the agencies involved. And while we have initially, we know that the lead agency is DHCS, and DDS is very involved in the HCBS settings rule. I think this long conversation that we had about housing as the critical H in HCBS is reminding us that it involves more agencies. It involves CDSS, it involves CDA, it involves HCD, just to name a lot of acronyms, but that we want to make sure that these systems are working together, and we want ongoing stakeholder engagement. So what I would propose, and would love to just hear from agency representatives here, is can we make a commitment to a stakeholder engagement committee on HCBS settings that would include representatives from the DACLAC committee, which is so intimately involved in this work?
Patty, that is a great question. And I think that, your recommendations were received. I will turn to any directors that want to comment, but my sense is that we might want to take this back internally and discuss it and see, given the engagement cross department, I think it would be good for us to think through that. Susan, anything to add to that?
No, exactly. We hear you, Patty, and that's not something we can commit to on the spot today, but we'd be happy to talk to you further about what that would entail. If others want to chime in, Director Boss, Director Bargman, Director Xavier is on today too.
Yes, I agree that it's worth the absolute consideration discussion as far as those next steps. As it was noted earlier, that we take a look at what our next steps are. DDS, we do have pretty active engagement on HCBS discussions. So as we do that, Patty, I really appreciate the recommendation to make sure that there's a crossover with the work of this group. So thank you.
Thank you so much. And we really appreciate the agency reaching for that participatory involvement. It's very important. So thank you. Over now for public comment. Are there any members of the public who are either calling in or on the line who want to be heard? If so, can you raise your hand?
There are about 3 hands raised in the call-in lines, Patty. So just to remind everyone, this time is reserved for your public comment. We're asking everyone to stick to the 2-minute limit so that everyone has a chance to speak. And you can press *9 if you're calling in, or you can raise your hand using the Q&A function. The first person that I see with a question is Sabrina Epstein. Sabrina, I will unmute your line so you can have your 2 minutes of comment. Go ahead and just unmute yourself.
Thank you. Can you hear me?
Yes.
Great. Hi, this is Sabrina Epstein from Disability Rights California. Thank you to all the panelists and all the members for this really great discussion. I just wanted to share 2 concerns that my team and I have at Disability Rights California about the HCBS settings rule, because we share in your desire to have it implemented robustly and with person-centeredness at its core. The first is that we are concerned about some of the settings that DDS oversees, the Department of Developmental Services, because there has not been as much communication and transparency regarding those settings and their plans compared to those overseen by Cal HHS more generally. And the second concern that I wanted to raise is that as of now, we don't see any way for residents and their family members to report concerns regarding their settings not being in compliance. I understand that some of the compliance is going to come in things like licensing for congregate facilities, but if someone's living in one of these facilities or their family member is and they feel like it's not a concern, right now there's not a very clear path for how to report it and try to get it fixed so that people can maintain their housing and have it be in compliance with the settings rule. So please let me know if you have any answers on those, or take it back and get back to me. Thank you so much.
Thank you. Up next, we have Nina Spiegelman. Nina, I will unmute your line and you can go ahead and unmute yourself and make your comment.
Okay, great. Thank you so much. Just wanted to say, wow, this was just really great. The emphasis, we really appreciate the emphasis on this HCBS compliance and the settings rule. My name is Nina Spiegelman. I'm with Disability Voices United, and I'm also a family member. And I just, you know, I can't say enough about the importance of this topic. And I do just have a few points I wanted to make, mostly related to, and questions mostly related to DDS. First, very much appreciate the recent directives. Very much appreciate the strong directives about the looming compliance date. But similar to what Sabrina just said, I think that it's really important that there be some way for the HCBS users, and I love the emphasis on the HCBS users, the people served and their families, to find out about, sort of what may or may not be coming for them and what the impacts are for them. And also, where do they go for support, both to, provide some way to report compliance issues or whatever problems they're facing, but also if their providers are going to actually, if they need to change providers because of HCBS requirements, what support and how they get it. I think that's going to be critical. And so overall, I would say, I think there's, everybody here is so steeped in knowledge and, all the details of the issues, but I think there are so many people out there who don't know what this is all about and what may be coming. And so more outreach and training, I think, is really critical. And then finally, and this is, hopefully, this is a data question. It was really great, and thank you, Hagar, for posting the good DDS compliance data. But one piece of data that we'd be very interested in is those are the settings and the providers, but how many consumers are affected? Who are what consumers are affected, and most importantly, how many? So if there's 5,000 residential settings, how many consumers does that impact? So in any event, I thank you so much again for all your attention to this, and the discussion was amazing, and look forward to future efforts to have a focus on this. Thank you.
Thanks, Nina. We've got Georgette up next. I've unmuted your line, Georgette. You can go ahead.
Hi, I'm Georgette, and I'm in Los Angeles. And I have a question about middle-class housing. I don't want to leave my family or the state, but when I go to look for a rental, there's a lot of problems. They look at me as I'm too old. I make too much money. to qualify for anything on Medicaid. And the waiting lists in most of the places that I look are 10 years long. So I'm wondering, is this going to be a state that's welfare only, disabled only? Or is there going to be something in the initiatives or something in the goal number 1, I would say, housing, that includes the forgotten middle class?
Thank you, Georgette. Moving to our last hand raised at the moment, we have Angela Jackson. Angela, I'm unmuting your line. Go ahead and ask and make your comment.
Hi, can you hear me? Hello?
Yes, we can hear you.
Good. Hello, everyone. My first time on here, and I really find I'm an IHHS provider, and I really find it very informative. The information that I've received, I have a lot to absorb and a lot to research. It's been a trying time sometimes with the client or clients that I've had. And to know that some of the options are wider, it's good to know. Being in the providing field, caring for someone, you have to love what you do to do it, because it's really not about the money, which the money isn't much at IHHS. But you have to love what you do. And so I appreciate the forum to be able to to get the insight on more things and possibly more things that are available for my clients and future clients. Thank you.
Thank you, Angela. We have Nahid Abuzar, who's up next with a question or a comment, sorry. Nahid, I'm opening your line and go ahead and unmute yourself for your comment.
Okay. Hi, everyone. Thank you so much for the valuable information and all that you do. This is my first time being in here. My name is Nahid Abuzar. I work for the North Los Angeles Regional Center. We provide support and services for individuals who have developmental disabilities. And we also provide supports to individuals who speak different languages, as far as the languages, Farsi, Tagalog, Spanish, and also we just added the LGBTQ specialist to our unit. Currently, we are looking for a speaker or a presenter who can provide presentation about aging and disability for our staff. I know understanding and knowing about the struggles and the issues all of our disabled aging community are going through. So I was hoping if there is someone who can help us with that, and so we can inform our staff regarding the aging and the struggles they're going through. And if you're interested, and if you can leave the chat open for me, I would leave my email address and my phone number. We will be greatly appreciated. And thank you so much for all the information that you gave today. I appreciate it.
Thank you, Nahid. And the last comment we have time for today in the 10-minute period is from Gail Hagan. Or Gail, I apologize if I'm saying that incorrect.
No, it's perfect. Thank you very much. Just want to make a comment that as choices for accessible housing and prices of housing and all of that is getting difficult, and to say the least, we're making it definitely a barrier for people with disabilities and seniors. There are also punitive policies and practices within benefits that do not allow people with disabilities and seniors to have roommates, or when they're living with other members of either family or community in the home, their benefits are reduced, their benefits are affected. And so as we remove, I'd like to ask that we look into those types of policies and practices and remove those so people can live with other people. They can find more options in housing and not be punished for making choices based on what they can afford and what is available and accessible. So they're not making the choices between a workable housing situation or their benefits, or or losing partial or parts of their benefits.
Thank you, Gail. And we can return it back to Patty, I believe.
Thank you very much. Well, the cost of all this great conversation and discussion is we're going to have a slightly shorter break, but I think it was eminently worth it. I can't say enough about how valuable these comments are. And I take that last one around looking at the way that the SSI program punishes people who try to share housing as a really important policy initiative we should look at. I'm going to ask you all to come back at 12 o'clock noon if you can. We don't mind if you keep your camera off and bring some food, but if we could meet back here in 10 minutes, that would be great. Thank you. See you in 10 minutes. Welcome back, everyone, from your break. And thanks for joining us again. I'm going to turn it over now to Sarah Steenhausen and Joseph Billingsley for a discussion of the statewide HCBS gap analysis and multi-year roadmap.
Great. Thank you so much, Patty. Well, I'm very pleased that we have now the repeat performance by our colleague, Joseph Billingsley. We appreciate your being here, Joseph. Joseph is going to walk through the Home and Community-Based Services gap analysis, focusing on the DHCS component, and then I will follow up with the information specific to the Department of Aging. And we hope to have at least 10 minutes for questions, because this is a very important initiative that we will look forward to all of your input on. So, Joseph, take it away.
Sorry, I started talking and I was muted. Can you all hear me now? Okay.
Yes.
I was saying thank you, Sarah and Patty. I'm very pleased to have the opportunity to present on both of these important topics today. And so just to, as Sarah was saying, provide a quick overview of our California's HCBS, or Home Community-Based Services gap analysis and multi-year roadmap process. As Sarah was identifying, this stems back to really a two-part process and was ultimately prompted by funding made available through the Money Follows the Person grant program that DHCS operates as California Community Transitions here in California. And so we look to take advantage of that supplemental funding to really align with efforts that the larger efforts DHCS is making towards in relation to the CalAIM initiative, and looking at how we our capacity and availability of managed long-term services and supports and HCBS services, and continuing to further the availability of those services through CalAIM and things like community supports and enhanced care management and other initiatives, as well as through various HCBS programs that DHCS makes available, and then corresponding efforts on the Department of Aging side to be able to look at where there are gaps in HCBS as well from a non-Medicaid perspective, so the larger population base. So just to go to the next slide, when we speak specifically about agency and organization roles, Department of Healthcare Services, as a single state Medicaid agency, is overseeing the Medi-Cal side of this HCBS performing the Medi-Cal specific HCBS gap analysis and multi-year roadmap. And then CDA is responsible for overseeing the non-Medi-Cal side of the project, providing key data for gap analysis and multi-year roadmap. Mathematica is the vendor that both Department of Healthcare Services and Department of Aging have contracted with to develop the analytic approach and conduct the quantitative and qualitative analyses and write the Medicaid or Medi-Cal gap analysis and the non-Medi-Cal gap analysis and roadmap, multi-year roadmap documents. Mathematica is also the contractor DHCS is using in terms of work on its LPSS dashboard. And the Center for Healthcare Strategies is a sub-vendor with Mathematica that is specifically leading the stakeholder engagement activities that are specific to both the Medi-Cal and non-Medi-Cal gap analysis and multi-year roadmap processes, along with providing updates to web pages and monitoring email inboxes. Next slide. So in terms of project activities, you know, just again at a high level, the DHCS gap analysis and multi-year roadmap focuses on Medi-Cal managed long-term service supports and home and community-based services, where the CDA focuses on non-Medi-Cal HCBS. Both are conducting an HCBS gap analysis, and then both will also be developing a multi-year roadmap looking to address the gaps identified as part of the gap analysis. Both will be engaging stakeholders and experts in this process. Additionally, CDA will be creating an inventory of core HCBS programs and availability by county. Next slide. And I am keeping it high level and trying to move through these quickly because I want to make sure, again, we have time for CDA as well, and also really to focus on questions and comments that you have. So in terms of intersections between CDA, the DHCS and CDA projects, again, both are utilizing quantitative analyses, looking to access data from various HCBS programs to characterize enrollees and providers that identify gaps in services. Both will also use quantitative and qualitative data and stakeholder engagement to bring different perspectives into the processes. And then we'll summarize findings from both projects with concrete plans for filling those gaps. Next slide. So just to quickly go over to DHCS gap analysis details. Next slide. So again, DHCS specifically is working to identify and analyze opportunities to expand access to Medi-Cal HCBS and MLTSS to address and close identified gaps as we work to transition towards a fully integrated MLTSS system, and also improve health outcomes, consumer satisfaction, and health equity for Medicaid beneficiaries in California. Next slide. Again, as I spoke to before, the gap analysis will use a mixed method approach to identify critical gaps in California's HCBS programs, and then work towards developing a multi-year roadmap that will look to address the results of the gap analysis and feedback from DHCS and other stakeholders, and specifically look at identifying ways to expand HCBS provider capacity, strengthen partnerships across state, counties, health plans, providers, and CBOs, and also identify key milestones and benchmarks to help DHS monitor progress. Next slide. Here we identified various populations of focus. Again, I don't want to go over these in detail, but make them available so that all can see the different populations that we're looking at as part of our gap analysis process. Next slide. Just looking at how this work connects to current work in terms of California's long-term goals, you can see there's clear intersection across populations and delivery systems in terms of looking to address what's available through managed care, looking at how the availability and use of no wrong door pathways, looking at how we're utilizing quality metrics and data reporting, also making sure there's intersection with other key developments that California has worked on, including the Master Plan for Aging, our HCBS spending plan, and then also looking at, where there's intersections and other work towards improving data availability and quality and transparency, looking at work we're doing with the LTSS data dashboard and quality. So next slide, please. And then just quickly, there's 5 main objectives identified within the DHCS gap analysis and multi-year roadmap. Those include reducing inequities in access and services, meeting client needs, program integration and increased coordination, quality improvement, and streamlined access. And next slide. And again, this just provides further detail. I want to make sure that you have this available for reference, but again, I want to make sure we focus on time for questions and comment versus walking through these slides in detail. So I want to just again put forward these slides for your reference and information. Next slide. And again, on to the next slide. And just from a timeline, you can see that currently at the beginning of this year, we've been working to set up access to all necessary data for our contracted vendors for Mathematica. We've also held a stakeholder engagement kickoff recently in January. Hopefully, many of you were able to attend that. Mathematica, again, looking at the intersection with our LTSS data transparency initiative, is also working on recommendations for our LTSS dashboard in terms of LTSS measures. And then we'll be working on, utilizing the data analysis that Mathematica will be doing, as well as stakeholder engagement towards building initial draft reports of the gap analysis findings starting later this year in the fall. And then working towards having a final report and multi-year roadmap available in summer of next year, 2024. And then working continuously towards development of state and local policy and procedure review and updates. Next slide. Again, we want to talk about and make awareness of interrelated DHCS LTSS initiatives. That includes the California LTSS dashboard. Next slide. Also, LTSS data transparency. And next slide. And then also looking at decent quality reporting. So again, we've talked about these in depth and detail in previous stakeholder presentations. We've got information here, and we can follow up with any specific questions you want to walk through. But in the interest of time, I'll move on to our next slide and pass over to CDA to cover, to give a brief overview of their corresponding effort. Thank you.
Right. Thank you so much, Joseph. It's such a pleasure to be able to work on this project in partnership with DHCS. Just for a little bit of context, this was a really key recommendation that came out of the LTSS subcommittee of the Master Plan for Aging when the state was in the process of developing the MPA. So we're really pleased that we have a companion effort to supplement the work that DHCS is doing on the Medi-Cal HCBS side to have a roadmap and a gap analysis of the non-Medi-Cal HCBS. Because as we all know, ensuring access to services is really, really connected to availability of programs and services across the state. We know that many areas may not have many services at all, and some areas might have services that have wait lists or that are for other reasons not available to everyone who needs them. So this is a really important effort, and I'm really happy to be at these early stages of launching. Next slide, please. So what I wanted to clarify is that for the CDA HCBS gap analysis that, as Joseph said, is being led by Mathematica, this is not just about CDA HCBS programs and services. This is about all non-Medi-Cal HCBS programs that are in other departments as well. So as an example, nutrition, caregiver support, supportive services, independent living service centers, aging and disability resource connections, all the programs available through the Older Americans Act, transportation and mobility services, affordable, accessible housing, as well as others that aren't on this list, such as adult day programs, which are the non-Medi-Cal component of adult day, adult day programming in the community, as well as assisted living. So we're really trying to get a whole picture of what services are available across the state to help people remain in the community and avoid institutionalization. This effort will require a lot of partnership with our sister departments and from this group. We need to think about how we define transportation and mobility services, how we define affordable, accessible housing. And that's why we're so pleased that the Center for Healthcare Strategies and a team led by Carrie Graham is going to lead the stakeholder engagement efforts related to this. Next slide. So again, just to kind of, as a summary, we are going to be developing an expanded HCBS gap analysis of the programs and services that were just outlined in the prior slide, as well as an inventory of these core home and community-based services programs so that we can actually look up programs by county, see where availability is, and try and map it out. And then finally, really what's important is what we do with that data. So we will have the data that shows where the gaps in the delivery system is across the state, but building out a multi-year roadmap as an approach to expanding our infrastructure will be really critical to address those gaps. And we anticipate that this project will be wrapped up in the spring of 2025. And I did want to note that our component of this project is being funded through a budget investment that was as part of last year's enacted budget. And we have $4.5 million for this component. Next slide. So again, I think this slide pretty much just reiterates everything I said in terms of the steps that we're going to be taking. And what I do want to note too is that in developing this multi-year roadmap, we're also including how we might measure our progress in achieving that infrastructure in a multi-year roadmap. So what does that look like? And we're really pleased that Mathematica is going to be working with stakeholders to try and think through how we actually monitor progress on that component. So next slide. So I think this final component, Joseph, do you want to take it over just to talk about the stakeholder engagement?
Sure, Sarah, thank you. So just to walk through our stakeholder engagement timeline, and I do want to emphasize that, and I think we spoke to earlier in the presentation around stakeholder engagement being a large part of this process. That just emphasizing that really the success of the corresponding DHCS and CDA efforts are really built upon not just looking at data, but really that stakeholder and process, ensuring that we're engaging stakeholders and a wide spectrum and range of stakeholders to get input on the process and really help inform the development of these gap analyses and multi-year roadmaps. And so the way we'll be doing that, and again, that process being led primarily through Center for Healthcare Strategies, is through public meetings, which we'll be holding just to provide updates on the process and looking at holding those at least twice per year. Also providing quarterly updates to various stakeholder groups, including this as quarterly updates to various stakeholder groups and committees that we're meeting with between throughout this year and into 2025. So over the next 2.5 years, really. Conducting key informant interviews and small group consultations that'll begin later, in summer of this year and periodically throughout the project. Also conducting listening sessions with individuals with lived experience, family caregivers, and direct care workers. Again, I'm looking at starting those this summer. And again, all these dates are proposed, but just trying to give you a flavor for what our process will be looking like. Next slide, please. And just to highlight ways that you can continue to participate and provide feedback. CHCS will be maintaining a list of stakeholders to receive invitations to public meetings. You can also visit our project webpage for more information on public events and to sign up for email updates. And please provide feedback. You can always email us in between designated stakeholder engagement opportunities to provide feedback, and we've identified where you can the email address that you can reach us at. Next slide. Okay, now on to the important part, hearing your feedback.
Great, and I did want to clarify, there was a great question from Marty Emoto about will the Lanterman Act funded services and the services provided by the Department of Developmental Services be included? And absolutely yes. I think it's going to be DHCS covering the Medi-Cal component, which is the DD waiver and other services, and then CDA will cover the non-Medi-Cal component of Lanterman. So we will definitely be really working closely with our department partners on this effort. So I see a hand from Jeannie.
Hi, thank you, Sarah, and thanks, Joseph. That was really helpful to go through the details from both departments. So thank you so much. I have sort of a pragmatic question about this. It looks really excellent the way it's laid out, but I'm curious about the timeline, given that it appeared that on the DHCS side, the inventory was completed in the fall of 2022 based on your timeline. But I'm curious about why it would take so long, given that you've hired 2 external consulting groups to manage this. And we won't have final reports until what I think I read mid-2025. So it's kind of just a practical, why is it taking so long? Even though I know there are lots of answers for that, but just kind of curious.
Do you want me to start, Sarah?
Yeah, you start. I'm happy to finish up.
I can definitely start. So I did just to step back to that timeline process. So we anticipate beginning to, or the draft report related to the HCBS, the Medicaid HCBS and MLTSS gap analysis to begin rolling in and for DHCS review beginning later this year. So in 2023, fall of 2023. Obviously, things that are informing that gap analysis, there's an exhaustive, both the quantitative and qualitative analysis that will be happening in the stakeholder engagement process. So those pieces will take time. We want to ensure that we're allowing our contracted partner at Medica time to really collect and go through all of the various data sources that we're looking to make available as part of this gap analysis, and then also to conduct that stakeholder engagement process. The final report, which will then be developed based upon input from DHCS and our stakeholder engagement process, is then scheduled we have that tentatively scheduled for in summer of 24, along with the multi-year roadmap, because that'll be that initial will be mathematical, be utilizing feedback from our initial review of the draft report to then help in crafting that multi-year roadmap to address the gap analysis. So the final gap analysis and roadmap is then due in the summer of 2024. And then that period of time that we identified from 24 to 25, that's continued work with our contracted partners in terms of then working to develop materials coming out of that gap analysis and multi-year roadmap in terms of like strengthening various policies or guidance or information that's going out to stakeholders for programs, et cetera, as part of working towards implementing objectives coming out of the gap analysis. So really we're just describing the multi-year process for developing the gap analysis, the multi-year roadmap, and then working towards implementing that multi-year roadmap.
And will it be one final home and community-based service roadmap, or is it going to be two, one from CDA and it's going to be two? So that would be an observation perhaps to rethink that part so that we have one document that can explain home and community-based services regardless of the payer source, because we sort of divided them between a payer source and a non-payer source. So just a thought.
Thank you, Jeannie. Appreciate that input. And this is why we wanted to launch these efforts at the same time to minimize confusion and to streamline as much as possible. So we appreciate that feedback. And I think it's fair to say that we are going to be starting to produce, it's going to be in phases. The gap analysis will come first within the next 12 months, and then we will be working on the roadmap as Joseph said. So everything will be done by 2025. So Nina and then Megan, and we don't have a lot of time because we need to make some time for sure for our subgroups as well. Nina.
Hi, good morning, everybody. Nina Weiler-Harwell, ARP. So my question is about the CDA gap analysis, but I can't recall if I asked this during the presentation on the 20th, but I was listening to this and really thinking about how somebody who isn't connected to the emails, isn't comfortable with Zoom, how do we ensure that gap analysis in particular are reaching the people who maybe don't know they can speak on for themselves? And individuals, certainly ARP can talk about what we heard from others, but it is more fruitful to hear from people really experiencing the gap. So we're happy to have a offline conversation. And how do we reach that harder to reach population?
No, it's a very, very great point. And it's actually something that we've been talking through, kind of a multi-pronged approach with CHCS and their stakeholder engagement, which includes talking to, the service users, the consumers who rely on the services and support. So what I'd like to say is that this is just really a first overview, but we are going to be following up. This committee will be key. So we're going to have several opportunities for you all to weigh in outside of these full committee meetings. So great point, Nina, and we'll definitely be following up to discuss more with you. Megan Burke. Oh, sorry, Joseph. Yeah.
I just wanted to echo what you were saying from make sure that was an echo
Great.
DHCS sentiment with CDA. Yeah.
Perfect. Megan.
Yes, thank you, Sarah. Hi, I'm Megan Burke with the SCAN Foundation. And as you were doing kind of the high level presentation, one of the things I wanted to dig into a little bit more was just the objective to reduce inequities and access to services, and just kind of what inequities are we looking at? And just kind of curious is with the gap analysis, are you going to be looking at, I think, access based on like culture, language, race, ethnicity, SOGI, just like knowing that just because there's a service in an area doesn't necessarily mean that everybody's accessing it. So just kind of curious as to how you're thinking about that.
Joseph, did you want to take a stab at? Oh, you are. Okay.
Yeah, sorry. No, it's just working to unmute there. And you raise a great question there, Nina, and I think that's an important part, and you raise a good point, is really looking at working to identify where inequities exist and how individuals are able to access services, and what are the source of those inequities. How are they tying back to demographics? What is causing those inequities? And so then, and looking at what are opportunities to address those inequities. So again, I think that's something that as we go through this process, an important piece of that will be working directly with stakeholders and especially individuals with lived experience in terms of understanding where those inequities exist and looking at strategies for addressing those.
Great, thank you. Thank you for those questions. I really appreciate it. So without anything else, I'd like to turn it back to Patty for transition to our next segment of the agenda.
Thank you, Sarah. It sounds like people have been given in the chat a way to sign up if they want to be involved in this process. As Nina pointed out, that maybe we're looking for broader opportunities for participation for people who can't interact via Zoom or email. We're going to move on now to a report from our two subcommittees, the DACLAC subcommittee on transportation, and Debbie Toth will begin, and then we'll turn it over to Marty Amoto, who will talk about the subcommittee on housing. So Debbie and Marty.
Great, thank you. I think I'm up first, or are you, Marty?
You are, Debbie. You're up.
I thought we were going to do the thumb battle. Okay, all right. Hi, we are running way behind schedule, so I'm going to ask you to please out loud slow me down if I'm going too fast. So hello, fellow DACLACers, state partners, stakeholders, and all of you other equally lovely humans who are here joining us today, partnering and supporting a California where all can live and thrive in their setting of choice. My name is Debbie Toth, and I am a Jewish woman with salty long hair that is a bit unruly today, and I'm wearing a black shirt. I have a few slides that are repeat slides, so we'll speed through them, but feel they are foundational in understanding the work of our subcommittee. So bear with me and my need for repetition and grounding us in the work, please. So first and foremost, this is the slide that is our North Star. And I also believe it is the single most not thought about principle ever in the delivery of transportation as a whole. This slide starts with a Stephen Covey quote that tells us to begin with the end in mind. And our end is this: imagine a world where everyone can get where they need to go when they need, period. We do not consider the mobility and access needs of people who don't drive and who can but need vehicles that are built accessibly. And so we don't plan anything with this in mind. And so we don't deliver anything appropriate with this in mind. And so entire groups of people are left behind, literally, and cannot do the very basic things in life so many of us take for granted. This subcommittee's work is about seeing this vision become a reality. Next slide, please. Here is another repeat slide, but crucial to understanding the subcommittee's work. So just a brief reminder, this work has been collective and inclusive and began last March, not even a year ago, with us defining our shared values, dreams, and fears. This allowed us to really hone in on what we wanted to accomplish and how. Going back to that principle of everyone being able to get where they want or need, when they want or need, we decided that we would have to change policy, budget, and mindsets. Ours and that of our partners at state agencies and in the policymaking world. We needed to learn how our state departments are structured and how they plan and implement programs, services, and projects. And they needed to see the world through a lens that prior to now had not been considered, or at least not outside of any tiny little checkbox somewhere. So paratransit and the 5310 program are tiny blips of accessible transportation for some, not the masses, and we're changing that. So how, you ask? Next slide. By considering the lifespan and accessibility approach to transportation policy, planning, funding, and implementation. So this too is a reminder slide about the work that we did in the master plan for aging stakeholder process. It's really quite simple. We need a policy framework that recognizes the continuum aspect of need. Disability and aging are dynamic processes, and a static system doesn't consider this, but the system can become kinetic, and it will. By creating entities called Consolidated Transportation Service Agencies, I wish they had a better name, CTSAs, we will call them, throughout our state, that are local and reflect local needs. Think rural, think suburban, think where there's no fixed route transportation, think where there are artificial turf lines, so transfer trips are imposed. I could go on, but the point is accessible transportation must be addressed locally with some overarching guiding principles in mind. So very similar to the Aging and Disability Resource Connections, they're local, they're partnerships, they coordinate care and services, there's no wrong door, you get the idea. So with CTSAs and funding them, you can have a single point of entry, one eligibility determination, and a world of services at your fingertips, ears, eyes, however you receive this information. So this slide lists some of the possible services and accessibility features a CTSA might advocate for in the transportation ecosystem, or provide themselves, or contract with nonprofits or other organizations to provide, such as volunteer driver programs, door-through-door services, same-day demand response trips, cross-county or statewide trips, and features such as rollability, walkability, wayfinding, and more. So you're all with me so far? I wish I could see at least 30 people nodding, but my screen is blocked, so I can't see your faces. So I hope you are, because here's where the presentation gets exciting. In the 9 months we worked together, 9 months, on this committee with Caltrans, with the California Transportation Commission, with writers, with providers, with a range of state agencies and advocates, we learned, we agreed, and we lifted these ideas. And guess what? Next slide. We had 2 huge victories. The first is our incredible group of MPA funders awarded Seamless Bay Area with a grant to lift this policy work and include the voices of those with lived experience in formulating it, which is amazing. Why? Well, it costs money to implement systems change. That's a thing, right? But what makes me super ecstatic is that Seamless Bay Area is a nonprofit organization that is not an aging or disability organization. Here's where I get excited. In my mind, if we could get everyone to think with disability and aging lenses in all they do, we can absolutely have an inclusive and accessible world. And this is a living, breathing example of that. Seamless Bay Area began its work to have a connected transportation system that is inclusive and seamlessly integrated. And in the course of their work, began to see that inclusion was conditional. And they intentionally began the work of looking at the exclusion of disability. And they have broadened their work. Their third sort of principle includes accessibility for all ages and abilities. Can y'all just take a moment and think about what our world would look like if housing, transportation, workforce development, healthcare, if all of our state departments did the same? I mean, I think this is our goal, but I'm watching it happen organically in this space, and I've watched injustices unintentionally hurled on our aging and disability community members for more than 2 decades of this space. So it's really emotional for me. I will talk more about this project on the next slide, but on to our second huge victory. Are you ready? Nina? I know you have, we have a bill number now, right? So folks, we have an author who picked our accessible transportation legislation. Hot off the press, you are the first to hear this publicly, fellow DACLAC attendees. I announce to you, Assemblymember Buffy Wicks, Social Service Transportation Improvement Act, Coordinated Transportation Services Agencies, AB 540. This legislation sets out to modernize the legislation that created CTSAs and to fund them. This is exactly what we defined as needed to create the systems change necessary to truly achieve accessible transportation. We have a long road to go and we need you. DACLAC as a whole and our biggie members, NINA, AARP, Disability Rights California, the Alzheimer's Association, Justice and Aging, all of us to lift this and pound the pavement to ensure this legislation gets passed. When we say it takes a village to do something, that's a whole different world. This is going to take a continent to make it happen. Anytime there's a budget ask and anytime there is a proposed change to the status quo in the world of transportation, there is an uprising. We need to ring the bell of justice and we need to march forward together. Next slide, please. But back to that first victory, just to give you a little understanding, without going into a huge amount of details. This project utilizes the voice of writers and proven best practices to create a policy blueprint for truly accessible transportation for all Californians, inclusive of all ages and abilities. I pulled out the first paragraph of the grant narrative because I feel like it perfectly illustrates where we are right now. The disability justice ecosystem in California is woefully under-resourced, often excludes the voices of directly impacted people, and is underrepresented in the transportation planning space. While important progress has been made in the disability justice movement, accessible transportation remains excluded and has shown little improvement in the past few decades. I think the most improvement that's happened has happened in the last 9 months, frankly. So the project objectives are to solicit input from caregivers and end users of transportation to inform that policy work, to develop the framework for statewide efforts for systems transformation, and to coordinate efforts to lift and educate policymakers. So I want to take a moment to thank the funders. They're listed here: Archstone Foundation, Gary and Mary West Foundation, May and Stanley Smith Charitable Trust, MetaFund, the Rosalind and Arthur Gilbert Foundation, the SCAN Foundation, and the San Diego Foundation. And I say all of those names out loud because it's rare to have a funder fund this work. Here we have multiple funders funding this work and ensuring, as part of this project, that the voices of those living this systemic and historical injustice are centered in our work. Next slide, please. And this is my final slide. I promise you, the last time you have to listen to me talk this long, and I'm actually have shortened it radically because we're late, but we have learned so much in the last 10 months. And I want to thank each and every state employee, advocate, service provider, California senior legislature member, system user, everyone who gave of their time, experience, expertise, and soul to this work. We have kicked some serious booty. Sorry, state. So what to expect in the next year? Well, we're going to start with meetings that are better organized and allow for greater group talk, thought, and sharing. I want to give a special shout out to David Mandel, who kept me honest with this. We packed the meetings with so much content, we bypassed our greatest resource, which was the humans in the Zoom room. So moving forward, our meetings will have one advocacy opportunity update from Zenit of DRC, one topic presenter or think tank activity, and the rest will be Q&A and discussion. So meetings are held on the second Tuesday of each month at 4 o'clock. And I'm going to ask the amazing Jackie from Department of Aging to please post the link in the chat for those who want to join next week on Tuesday at 4 o'clock, when our key presenter / think tank discussion facilitator is Zenit from DRC. We will be learning about and brainstorming on inclusive transit-oriented development, because we are not one-trick ponies and we look at the intersection of transportation and all the other things. Also, in 2023, we will be continuing our policy support and education for our legislators, state partners, and lifting our legislation. And in putting our money where our mouth is, we feel very strongly about having this work led by someone who lives the challenges of inaccessible transportation. We are working to ensure my transition out of the chair role and another DACLAC members rolling into the chair role is done seamlessly and with support. And there's more to come on that next week if you join us at our meeting. So we have an ad hoc work group that will continue its work on developing an operational definition of accessible transportation. And finally, we will continue our cross-pollination education and partnership with our state friends and working with other departments and other places and spaces. So I think with that, I have done my 20 minutes and 13. Sarah, do I get a gold star?
Thank you, Debbie. You get a silver star. That was fabulous. We're going to turn it right over to Marty, who's going to report on the housing work group.
And I'll be quick. And I just want to do a shout out to my buddy, Debbie Toth. And, you know, our friend who passed away many years ago, an advocate, Maggie D. Dowling, she'd be tremendously proud of you and everything this committee is really doing, because it's so person-centered, just reflecting everything that she had fought for so many years. My name is Marty Emoto, CDCAN. I'm a family member, CDCAN, California Disability Aging Community Action Network. I'm a family member, now a parent of an adult 30-year-old with Down syndrome. We're adopting each other legally. He had a major healthcare crisis. He almost died over the last several months. And so I was engaged, and we both were actually in that healthcare crisis from late September all the way through January, and engaged in every system of healthcare, the emergency room, the hospitals, nursing homes, and regional centers, and also definitely, and thank God for the home health agency that we ended up having, that actually the combination of all those services saved his life. And I just want to let you know that everything we talk about today is real to a lot of families and to people, to those who are providers. This is what we want to prevent, is someone dying needlessly. And something we fight for is someone getting the health care, getting the supports that they need when they need it. And my family, Alex and me, got the help when we needed it. And we got the help in the shape that made a difference in his life. And I just think that if he was living on his own, his housing would have been threatened. He would have been homeless, or because he was put in a nursing home for a couple of weeks. And so we're talking about things that are very, very real. One of the things at the Day in Action that I remember seeing when we talked about transportation and housing, it wasn't just bullet points. It was, you could see in the audience, the fear, the anxiety, and the sense of urgency people felt about these issues that we're talking about. They're real. I talk about our friend, Debbie, again, Maggie, one of the fears she had until she died was the fear of losing her home constantly. And it wasn't because she couldn't afford it. It was because she was worried the landlord was going to evict her and sell the home. And she had no place to go. And she was also worried about getting the services she needed to her IHSS workers, because if she lost them, and there was always that threat of losing a worker or not finding a worker, she would be forced out of her home anyways. And that is the constant fear and anxiety and the sense of urgency that we're having to recognize, and we have to be responsive to. And so one of the things the subcommittee is going to do is, just like the Transportation Committee, resume meeting monthly and also meet as often as needed. In addition to that, focusing in on, as Patty, you were saying, on the things that local governments, local entity and agencies are doing. One of the things, I'll be sending out an email with the meeting dates, surveying the subcommittee members, and it'll be open up to all members of the full committee. But one of the things that we can do is what was raised today in today's committee meeting is, what is San Diego doing in terms of rent subsidies and helping older adults or other people? And in addition to that, look at what are the state agencies doing that are promoting or preventing homelessness or promoting housing opportunities for people. Sometimes there are programs that a state agency is doing that is not obvious that it is about housing. A good example that we can focus in on and drill down is what the Department of Developmental Services is doing, DDS, in an initiative that is funded through the HCBS spending plan. It's called the Coordinated Family Services, that if you just looked at that title, would not realize it has anything to do with housing. It's everything that actually allows an adult with developmental disabilities to remain in their own home and receive services that are under current state law may be prohibited. And so it maximizes in many ways housing options for individuals and families. And so we'll be looking at all those, and drill down, as the subcommittee meets. And so appreciate the indulgence of the committee and the subcommittee members during the time of this healthcare crisis. And I wanted to add one last thing, Patty, and I really appreciate you always emphasizing that, HCBS and remembering the H is also about housing. I also think that we all recognize that the H also represents a person in that house. And the person, and my commitment to you, Debbie, and the members of your subcommittee is, we will always, always, always link the issue of housing to transportation. You cannot have one without the other. And we also will link it to the other issues that makes the community living possible for my family and others. And that is food security, healthcare, and the needed long-term services that an individual may need. And combined with all those things is what makes up housing or someone who's able to live in their own home. And by the way, last point is, you know, Georgette, one of the people in the audience raised a point about what are we doing, or what are the solutions or alternatives or help for those who may not qualify for Medi-Cal or quote in the middle class. And I think we need to look at housing options and in ways is the state addressing, you know, providing help to those individuals. And lastly, is we'll be exploring the housing need throughout the state in terms of, as we're meeting as a subcommittee, you know, what is the housing need? What people are in crisis of losing their home among the IHSS population, among the DD population, among older adults. I don't think we know that. And then what's our potential responses? So, and also we'll be looking at, as time goes on, various policy proposals, whether it's in the legislation or budget proposals in the coming months. And I'll turn it back over to Patty.
Thank you so much. We are running behind, so I want to make sure we keep moving, but I really appreciate the tying together of the housing and the transportation, because it's not just a house, it's a home, which means a place where people live. We are going to make sure that we have time at our next meeting to have a discussion of the California Aging and Disability Research Partnership. But I wondered if, Ross, you wanted to just jump on very quickly to tell us that you'll be meeting with the subcommittees and that we'll have you come back at our next meeting when we can give you a real block of time.
Sure, Patty. Hi, everyone. I'm Ross Lawley, and I'm the Chief of Research in the Division of Policy Research and Equity at CDA. I'd love to come to subcommittee meetings and talk about the California Aging and Disability Research Partnership. There's a lot of overlap in priorities, and I think it'll be a really good discussion. I had a few slides to share with you today, and maybe I can just touch on the first slide, if that's okay.
Sure.
Go to the slide, please. So the high-level purpose of this research partnership is truly functions as a partnership between state government and academic institutions. So CDA, along with the Center for Data Insights Innovation, collaborate to lead efforts on the state government side. And we're just really fortunate to partner with some of the top aging and disability researchers in the country to form this research partnership. And the partnership is focused on advancing aging and disability focused research to strengthen the evidence we have to promote equitable opportunities for all Californians. So we'll be prioritizing research efforts that align with the goals and priorities of the Master Plan for Aging, research that can inform policy, and research around disability and aging that is meaningful and promotes equity. And the research partnership also help develop key outcomes and provide input on key data sources to measure impacts of the Master Plan for Aging. And that's what I wanted to speak to you today about. So I'm looking forward to those subcommittee meetings. It's going to be critical for us to measure the appropriate metrics, leverage meaningful and high value data sets, and then be able to convey this important information, tell our story to many different audiences. And then finally, this research partnership, we hope, serves as a model for the state. We want to build an example that others can leverage about partnership between state government and academic institutions, how folks can use data and turn it into action. And we want this to be a model that can be replicated. So I'll stop there. I know we're running short on time. Looking forward to.
Thanks so much, Ross. And we really welcome you back to our next meeting.
Thank you, Patty.
Very exciting, and it will provide.
Can I add one thing in, Patty, just as a plug for this great work that Ross is leading? The reason that this is so important for this committee is one of the key efforts right now that this Aging and Disability Research Partnership is doing is trying to identify key outcomes to measure our success in advancing the MPA. So key outcomes, not just the data that we have, but what are the outcomes we're looking for? One of those focus areas is looking at housing. And so that's when Ross talks about meeting with the subcommittees, he's referring to how we really think about defining that housing indicator. So more to come on that. I just wanted to plug that.
Thank you, Sarah.
Thank you. And we look forward to seeing you at the subcommittee meeting as well.
Okay. Thank you,
I want to
Patty.
make sure we've left a couple minutes. We are running late for public comment. If there are any members of the public on the line. And I can't see it, so I'm going to let somebody from CDA help me out here.
Hi, Patty. We have one hand raised from Yale Hagan. I will unmute your line, Yale. Go ahead. You'll have to unmute yourself one more time.
Okay, are you able to hear me?
Yes.
Yes.
Okay, awesome. Thank you so much. I just wanted to make a comment about transportation. I have so much respect for the work that you guys have been doing. It's really great victories. I just wanted to make sure that there is an understanding that there's a huge population of us who use transportation that no matter how accessible public transportation becomes, which it should, and it absolutely feels a humongous need, that there's also an eye on those of us who, no matter how accessible public transportation, we would not be able to use it without services like paratransit. And further, there needs to be, there's an issue between public transportation and paratransit that we don't lose, we do not lose service areas like we are in danger of experiencing in LA County, because the bus lines change, and therefore the understanding is that paratransit services may change their service area, which does not have to happen. That's absolutely the minimum, but that communities, the outside communities, the communities in the fringes, do not lose their service area just because the bus lines change in those areas, because those of us with disabilities or seniors do not have the luxury of being able to move around just because our transportation changed. We cannot move our housing. So as you're looking into these policies, please keep that in mind. And I'm very much interested in working with the committee. I'm not sure how to do that.
You just did. Sorry. Can I just briefly respond to that
please,
commentary?
please do.
So I just want to thank you so much for elevating all of that. So something that many people don't understand is the way that the Americans with Disabilities Act was structured. It links paratransit inextricably with fixed route transit. So if there's a particular fixed route transit bus line that's happening and they cut that line, everybody along that line within 3/4 of a mile of the fixed route stops in that area loses their service 100%. So I think there's some overall work to be done on the original work of the ADA, which created paratransit, because it was a hard fought victory, but there are some unintended consequences in the way it was structured. And at some point, we are going to have to dive into the ADA and make some changes. And I do want to say paratransit is not at risk with the work that we're doing. We are trying to fortify what we have already, add more, lift more, and make more accessibility possible. So I just want to thank you. And as long as we have your email, we will add you to the distribution list to join our committee. Thank you.
Excellent. I understand there aren't any other public comment on this piece of the program, and it is time for us, I think, to wrap up. I want to turn it over to Director DeMorris for any closing comments.
Thank you, Patty. Thank you, everyone. And boy, we packed a lot into this meeting, and we're coming in hot right at 1 o'clock. I want to thank everyone for your participation, especially our cabinet agencies and our fellow directors who have joined today. I'm so impressed that we're talking about all of the right issues and the important issues, and we're not, we're just busting down silos. There's not one department, there's not one agency, there's not one program. We covered the gamut today, and that's how people live. And I want to go back to, what Peter said is, compliance is the floor. And it's really, where we begin. And I am so confident that this state will raise the floor and, deliver services in the in the home, in the community, as people want them. So, and that's going to happen because of all of you. And, Debbie's update with the bill that's been introduced is testament to that. And there's, countless other examples of things that are happening up and down our state because of all of you and with all of you. So thank you so much for your time and attention, and Patty and Eric for your leadership today. Debbie and Marty for your leadership, and to all of our panelists, really, really appreciate your contributions. Thank you all. And our next meeting, I think our next slide tells you, yep, we're going to meet again June 7th and then finally on October 11th, but there will be work group meetings in between, and you're all welcome to those. So thank you. And thanks for the extra minute. Have a great rest of your day.